Welcome to Module 9 of the NHS Insights programme, which will provide an introduction to evaluation. In this session, we'll explore how evaluation helps healthcare innovation move from promising idea to proven impact. Evaluation is essential for demonstrating value, not only clinical value, but also operational, financial, and patient experience benefits. In modern healthcare systems like the NHS, innovation must show measurable improvement before it can scale. By the end of this session, you'll understand what evaluation is and why it matters, how logic models support evaluation planning, and how to design, conduct, and use evaluations effectively. This session is designed to be practical. Whether you're developing a new service pathway, digital intervention, or clinical tool, the principles we cover will apply across all settings. This webinar is one of a series of training modules in the NHS Insights programme. The aim of these modules is to develop a culture of innovation, improve basic innovation-related knowledge, and also to empower all staff to be innovation aware and ready. The NHS Insights programme has clear aims, which are to support evaluation of innovations in real-world settings, to strengthen organisational innovation capacity and infrastructure, to build an innovation culture and talent pool, and also to pinpoint what works to lead to national practice. You can find out more about the programme from their website shown on the screen. So what is evaluation? Evaluation is the systematic collection, analysis, and reporting of information about an activity to understand its effectiveness. In healthcare, evaluation helps answer fundamental questions, such as what works, for whom, how does it work, and what impact does it create? We evaluate to understand outcomes such as patient experience, clinical effectiveness, service efficiency, and long-term impact. Importantly, evaluation is not simply measurement. Measurement tells us what happened. Evaluation helps us understand why it happened and whether it matters. Before you start planning an evaluation, you will need to understand what's going on with that service, what's happening within it, and what the likely outcomes might be. In an ideal world, you'll start thinking about the service change many months before starting an implementation project, what you're going to incorporate into the evaluation, and how that will align with a logic model approach. So what is a logic model and why is it important? We use logic models because they help to identify and show relationships between different inputs, activities, outputs, and outcomes, because they show the links between these different elements. They provide a roadmap for change through storytelling and demonstrating impact on a particular target group, and they support the planning and development phase, implementation, and evaluation. So a logic model is a visual roadmap showing how an intervention is expected to produce impact. It clarifies the problem being addressed, what activities will occur, and how those activities lead to outcomes. Think of a logic model as a structured theory of change. It captures assumptions about cause and effect and provides the foundation for evaluation design. Without a logic model, evaluations often become unfocused or collect data that cannot demonstrate impact. There are several key principles of effective logic modelling. First, it should be collaborative. Stakeholders bring different insights into how an intervention works. Second, a logic model includes inputs, activities, outputs, outcomes, assumptions, and contextual factors. Third, logic models should evolve. As the implementation progresses, assumptions should be reviewed and refined. Finally, logic models are not just planning tools, they are the foundation for evaluation strategy. This slide shows the typical structure of a logic model. It begins with context and external factors, policies, workforce capacity, or environmental conditions that may influence implementation. Next are objectives, the overall goals of the program. Inputs describe resources, such as funding, workforce, and technology. Activities are what the program actually does. Outputs are the immediate evidence produced, for example, the number of patients treated. Outcomes represent short and medium-term benefits. Impacts describe longer-term system or population change. Finally, assumptions explain what must be true for the intervention to succeed. This structured approach ensures evaluation is aligned with the intended change. Evaluations in healthcare commonly measure both outputs and outcomes. These can be confusing. Outputs often include things like business cases, training numbers, pathway uptake, budget impact analysis, and implementation guidance. Outcomes, on the other hand, may include things like improvements in clinical indicators, reduced hospital admissions, improved diagnostic accuracy, workforce efficiencies, or overall patient quality of life. Understanding the distinction between outputs and outcomes is essential. Outputs show activity, outcomes show value. The other thing to think about in terms of logic models when you're developing your model is thinking about the short, medium, and long-term outcomes and thinking about where the data is available and how you might get access to it. When you're planning your evaluation, focus initially on the outcome or the goal that you're trying to achieve. And you can consider how and where you can access data at a later stage. Here's an example of how a logic model can be used to tell a story. In this case, that of the Young Enterprise Company. This logic model focuses on how they empower young people through hands-on work readiness, financial education, and entrepreneurial skills. Company program allows students to set up and run their own student companies, providing real-life learning opportunities. The model emphasizes building confidence, managing money, and developing entrepreneurial skills, which are essential for future employability. The program also aims to foster a positive impact on socioeconomic conditions and improve self-awareness and confidence. Now you've got your logic model, you can start to think about planning and evaluation. Before beginning any evaluation, 3 critical questions must be answered. Why is the evaluation being conducted? If there is already evidence that exists that shows your evaluation works, why is another evaluation needed? Think about using the existing evidence if you can. Secondly, what governance structures are in place around the project? Third, who will use the results once published? Again, if the answer is no one, why are you conducting the evaluation? If the answers to these questions are unclear, do not start your evaluation. Evaluation must be purposeful, ending with a decision. That decision could be that we'll recommission what we are currently doing, or we'll change something depending on the outcome. Data collection without a defined decision need wastes resources and rarely influences practice. Evaluation design begins with the logic model and stakeholder collaboration. Key steps include defining the intervention you want to evaluate, determining how and where it is being implemented, clarifying the purpose of the evaluation and how the information will be used, developing the evaluation questions, and identifying the resources and methodology you'll need to conduct the evaluation. Good design ensures evaluation is feasible, relevant, and capable of informing decisions. If nobody's sure what that intervention is and what it's trying to achieve, your evaluation will almost always fail to achieve its purpose. Take the time to agree across all stakeholders what the intervention is and what it's trying to do before you start your evaluation. Healthcare evaluations may use different methodological approaches. Examples include process evaluations, outcome evaluations, and economic evaluations, such as cost effectiveness models or social return on investment models. The choice of method depends on what you need to know and how the results will be used. Much like designing a pitch deck, think about your audience when choosing which type of evaluation you will need. Clear evaluation questions are the foundation of good evaluations. They should specify what you want to know, be informed by prior evidence, and guide methodological choices. Evidence sources may include clinical standards from organizations such as NICE. Strong questions ensure the evaluation process produces meaningful, actionable insights. This example illustrates an evaluation of a mental health crisis intervention. The aim is to describe the impact on crisis resolution and referral outcomes. Objectives include exploring patient experiences, assessing referral outcomes, and understanding system integration. This example shows how evaluation moves beyond outcomes to understand how interventions function within healthcare systems. Data collection should be guided by the evaluation questions. Important considerations include relevance of the data being collected, feasibility within the required timelines, the availability of baseline data, analytical expertise, and ethical governance requirements. At this point, when you're thinking about data collection, you will need to think about how realistic it is to extract the data you need. If that's not available, what are the proxy measures that you could use instead? Planning data collection carefully prevents gaps that can undermine evaluation credibility. Evaluations typically use both qualitative and quantitative data. Qualitative data helps explain why and how change occurs. This is often collected using interviews, focus groups, or observations. Quantitative data measures the scale and magnitude of change. That could be such things like admission rates or blood pressure change, for example, as clinical measures of change. Combining both qualitative and quantitative data provides a richer understanding of the potential impact. Don't wait until the end of your trial or pilot to understand whether data is available. Do that at the outset, particularly if it's a complicated request or requires new workflows, as this may take some significant time. There are a number of different ways that you can collect that data or access it, and some of them are shown on the screen here. Data analysis involves structuring and interpreting information to answer evaluation questions. This process can be complex and requires preparation of accurate data sets, appropriate analytical methods, and collaboration across teams. Planning analysis early improves efficiency and ensures results are meaningful. Effective reporting depends on the audience and purpose. Reports should consider who will use the findings, what decisions will they inform, and how best to communicate the results. Don't just include data for the sake of it in a report. Keep your report concise and relevant for the intended audience. Clear, accessible reporting increases the likelihood that evaluation findings influence subsequent practice and policy. Evaluation is only valuable if findings are actually used. To maximize impact, communicate clearly, engage all stakeholders, revisit your logic model in the light of evaluation findings, and plan next steps with accountability. Evaluation should always drive learning, improvement, and ultimately decision-making. To summarize, evaluation helps demonstrate effectiveness and value. Logic models provide the foundation for evaluation design. Clear questions guide data collection and analysis. And evaluation findings must always inform action. Here's an example of a case study that demonstrates the real-world evaluation of a wearable cardiac monitoring patch. The evaluation examined the usability and practice, the integration of the device into care pathways, the effects on clinical decision-making, the economic impact of the intervention, and patient acceptability. The results illustrate how evaluation can support adoption of innovation by generating real-world evidence for decision makers. To support your evaluation planning, there are several resources that will help you in the early planning stage. These include guidance from NICE, from Emergency Treasury evaluation frameworks, and from various NHS evaluation toolkits, including the Health Innovation Network's guides to real-world evaluations. You can use these resources in your planning stage. They will help you provide the standards for rigorous and transparent evaluation. We'd like to acknowledge the input from NHS Norfolk and Waveney ICB Evidence and Evaluation Hub in the content for today's webinar. Thank you for watching this webinar. If you would like to get involved or find out more about the NHS Insights programme, please visit their website shown on the screen, or contact your local innovation team or leads in your own organisation or ICB where appropriate. You can also find out more about innovation and related activities through engaging with your local Health Innovation Network. Thank you again for your time and engagement in watching this video.